So welcome everyone, and without further ado, I will pass over to Neil, who's going to give us some information on My Care and what it's all about. Thanks very much, Neil.
That's great, Dawn. And thanks everyone for joining. I'd like to say this is a vote of personal popularity, but I know it's not. This is a very topical subject. Sharing healthcare information is an important thing, whether it's your own, whether it's someone else's. It's a very sensitive thing. And just my background, I'm the chair of the regional My Care governance and decision group at present, and I've been chairing a group with respect to My Care since just before the Southeastern Trust go live. I'm also the Chief Clinical Information Officer for the Western Trust, but actually more importantly, and one of the reasons I got involved with this was that I'm a practicing clinician and a consultant physician, and I'm involved in acute care and long-term care, and I really understand and value the value of sharing information with people whose care it's about. So we'll move on quickly, and should be able to see slides on the screen, hopefully.
Yes, that's good.
Good job. Okay, so welcome to this episode of Digital Dispatches about My Care. Let's see if we can move on. Okay. Encompass, the programme, is implementing the EPIC system right the way across Northern Ireland. And this will be a single record, single digital care record for all Northern Ireland citizens receiving health and social care, which is quite a unique phenomenon. We have an integrated healthcare system, and this is one of the first times ever that EPIC has had an implementation that's included social care, never mind the entire healthcare economy of a country. The aim is to deliver safe, high-quality care. And the implementation timeline you're probably aware of. The Southeastern Health Social Care Trust went live in November last year. So for a full year, in fact, over a full year, they've been getting used to this record. Belfast then in June this year. Northern Trust just last month and went live. And the Western and Southern Trusts will complete this on the 8th of May 2025. At that time, all of the hospitals in Northern Ireland will be on one system, and you can already feel the difference now whenever we have 3 trusts live and how interaction between trusts is more fluid. But whenever it comes to our whole of Northern Ireland, it's really going to release the potential of the system. The plan is here better experience for patients, service users, but also for staff, and a much easier access to staff for vital information, both in clinical and community settings. My Care is different. It's different, but it's the same. It's a portal into that healthcare record. It's part of the Encompass program. The information from it comes from the full record. We've got enhanced levels of access. We can view healthcare information online via computer, tablets, or mobiles, and it's optional. My Care is an app and a portal which complements but doesn't replace traditional communication methods. We're human beings. We all rely on person-to-person communication, and that's important for how you receive information in a sensitive way, but also how you receive information in a tailored way, in a way that's contextual to who you are and what you understand, in a way so it's clear for you. So this information that's available in the My Care app does not replace that human level of communication that we already do, and that human level, which is highly skilled and informed, of how to tailor that information to the person. Let's see. So Encompass itself, as the main production system, is used by health and social care staff, and My Care is used by patients and service users. And this is a way of sharing information with people to allow them to actively engage in their care, whether that's knowing their upcoming appointments, having a record of when their previous appointments were, but also healthcare information, and that includes things like results and also letters, whether that's from an outpatient attendance, day case attendance, or an admission and discharge. This information and this app belongs to the person, belongs to the patient or to the service user. They can view information about the healthcare information and journey, but there's more than that coming, and there's lots of features that we're looking at and functions that are available within the overall EPIC system that we hope to be able to adapt and adopt for Northern Ireland that will improve healthcare experience. Your healthcare information within the My Care app, it provides key identity details. and contact details. You can see a health summary, past conditions, medications and allergies, see your future appointments, aftercare letters after visits, view test results from secondary care hospital specialists, but crucially, it does not display tests that have been requested by your general practitioner from primary care. That's important because those investigations remain the responsibility of those practitioners to communicate. On the other side of that is that if you've had an appointment with a hospital practitioner and there's information available, results available from that, it's their responsibility to communicate and to act on that and to bring you that information. And that's crucial because those specialists understand that information in the context of your healthcare conditions and are best placed to help explain it to you. So it's very, very important that that comes from the specialist rather than you ask for that information from your GP. And we're looking at the information that's provided within My Care to make sure that that's clear to people, because not everyone will understand the distinction between primary and secondary care and what they mean. Even saying hospital or specialist can be difficult. I mean, GPs are specialists in primary care delivery. So getting that information across in a concise and understandable way is important. And as healthcare professionals, it's really important that we know what results are in My Care. In the future, we hope to make available access to trusted healthcare resources to help support the delivery of care and to help someone understand the conditions that they have or that we're thinking about. And we also hope to be able to set out secure electronic communication with the healthcare team. At the moment, we can send one-way messages from a healthcare professional to the patient or service user, and that's really useful whenever a result is published or we publish them, that we can provide information that's relevant to them, never mind the letter which is to come. Sign up for this. An NI Direct account is required, and this is the standard established way now for us to verify our identity with respect to access to healthcare and other government information and other government records. This verifies identity only, and it's not linked to the healthcare record. Like, the government can't then view your healthcare record. It's simply a way of confirming your identity. You can then set up a PIN or use biometrics such as a fingerprint or face recognition for easier access to the app. If you can't set this up, then you'd have to put in the NI Direct login details each time. So it does make it very, very slick to be able to access the app. There is a challenge with respect to those that are younger, and that post-primary age users may have difficulties if they don't have a passport or a driving license, which are the main accepted ways of using photographic ID to identify yourself. But NI Direct are working in partnership with the Department of Health on a long-term solution for this. There is a clear NI Direct helpline for people to get assistance. How do you sign up? You download the MyChart app from the App Store or Google Play. And inside the app, you can find and choose the Health and Social Care logo from the drop-down menu. It's pretty clear, very easy to find. You can then sign in through the web page of the app, and you'll be directed to NI Direct. The NI Direct account is used to prove identity and provide access to My Care. If you already hold an NI Direct account, you can use your current login information. And if you don't, you would have to create one in order to use My Care, and that has other identity requirements. The key information: historical information. No medical records prior to November 2023 will be in My Care. Whenever the system went live, it went live with current ongoing information, not the historical information, other than what's added retrospectively. Only secondary care information is currently held. GPs can access this information, and they use an app called Epic Care Link. That's also used by us who live in areas covered by trusts that have not yet gone live. It's our window into the system. It is an evolving system, and we have a number of different groups that we'll talk about in a second that where patients provide feedback, and also the Trust Regional Governance Group, and we receive information through and opinions through on primary care and what can help them as well. More information will be available on the app as each trust adopts it, and we're now at a stage where 3/5 of our trusts are live, and we've one more go live, and that'll be with Western and Southern Trust at the same time on the 8th of May 2025. And after that, live information will be available for all trusts in Northern Ireland. It's free, and crucially, it's not compulsory. Again, this is supplementary to standard communication methods. So it's important to know that while this can help, if you have a member of the family who's less digitally fluent and don't feel they can do it, yes, you can assist them to be able to access this app for their own information, but it's not compulsory. They can still receive information through other means. It's protected by law. Healthcare information is highly sensitive. It's protected by the UK Data Act and the principles therein. It's secure in its access is controlled by usernames, passwords, and direct identity verification. But we need to talk about proxy access, and I've alluded to that for those that may be less digitally enabled, and you helping, say, a relative or someone you're caring for to get access to it. But a third party like you who's involved in someone else's care can also request proxy access. Now, a competent adult can choose to give you access to their healthcare account to help you care for them. Reviewing upcoming appointments, making you aware of healthcare details that have been shared, like letters and results. But also for those that are not competent, with respect to young children, but also looked after adults and others who lack competency to take care of their own records. That can be done in conjunction with a social or healthcare professional, and the level of access is then set by the professional in the best interest of the service user or patient, but also on what seems to be reasonable. These are the current registration figures. You can see that just under 73,000 people are now registered on My Care, which is quite a phenomenal achievement. 40% of those are in South Eastern Trust, 30% in Belfast, and 23% in the Northern Trust. And even some people in Southern and Western Trust, even though we're not live, are starting to access this. Some of these are healthcare practitioners looking to get information about the app and what it holds. And actually, personally, this has been a really, really good way for me as a healthcare professional to understand what this app does, what's available. So please do go yourselves, download the app, log in through NI Direct, and have a look at what it is. You, as a healthcare and a social care professional, can learn an awful lot about what will be available to the people that you look after when you go live. Interesting fact, right over on the right-hand side, that 8% of the South Eastern Trust total population is now live on the app, which is quite a phenomenal achievement. The uptake for after go live in the several months after go live is very variable from implementation to implementation outside Northern Ireland and before we've gone live, and ranges somewhere between 10 and 70% of the population. So we're already there. Within a year, we're already starting to get there. This will rise, and actually this is rising currently at a rate of about 300 people per day across Northern Ireland getting access to the app. And this has accelerated a lot, and it's roughly the number of people accessing or registered in the app has roughly doubled every 3 or 4 months, believe it or not, since the few months after the South Eastern Trust went live. So it's accelerating. In Northern Ireland, we're hungry for information about ourselves because we've lacked it for so long. And you can see the potential benefits to how people can engage with their care. I mentioned a couple of engagement, different groups. We have the engagement which help inform how we're going to develop My Care and what functions are available and how it's looked after. We have an engagement council. It's a setup of the patient client council, independently, meets monthly, and around 10 service users from all different trust areas work to help inform the design and the delivery of My Care. There's a regional governance and decision group, which I chair, and meets monthly with all trusts represented and most different professions represented, and the focus there is on current features and enablement of new features. We have the Engagement Council subgroup on disability and accessibility. This is a new group starting to meet monthly, and this is patient representatives from the Engagement Council. And that's really important, obviously, because we need to think about equity of access and facilitating that where it can, making sure that it meets people's needs. There's the EPIC quarterly accessibility meet, which is a wider one, and this is to discuss My Care accessibility. We haven't got that one set up yet, and we have no patient representation on it, but it is planned. And finally, with My Care Trust My Care workshops, and about 3 of these have happened so far, and they're now monthly. We don't have service user representation, but there's a vision to have that taken up. Contact details. There is a help desk. There's an email account, and there's a telephone number, and the help desk is available on a Monday to Friday from 9 to 5. About 2/3 of people access the help desk through email and about 1/3 through telephone. And about a third of the requests for information are about tests and understanding what information is available, what is not as yet, what is manually released, what is automatically released, and also where that information has come from and what will be released. That's a distinction between primary and secondary care that I've said. And interestingly, about a third of other requests talk about or ask about proxy access and how you can get proxy access. And that is really encouraging, that people are looking to engage with information about those that are a wee bit more vulnerable in particular. So that's a quick whistle-stop tour of My Care. I'm going to stop sharing now, and we've had a number of questions placed in the chat, but we have a hand up from Carolyn Davies.
That was an accident. So it was.
Okay, no worries. Declan Keenan.
Thanks for the fantastic presentation. You alluded that My Care is currently a one-way street from trust down to patient. Do you envision it being a two-way street? And if it is a two-way street, whose responsibility is it to respond to the query? And then the second thing is, how is that activity going to be recorded?
Declan, that's a hugely important thing, and it's very, very topical. It's okay having a method of communication, but there's no point in us firing a paper plane into a trust and expecting it to land in the place that it would. We need responsiveness so that your message is acknowledged and is passed forward to the right place to get the right information back. And we're looking at pilots currently in the South Eastern Trust and Belfast Trust of services that can operate a response pool. So when the message comes in, they're able to make sure that that information's got through to the right professional or administrative individual to make sure that information gets back. So currently we're looking at how that can be done and implemented among a number of different services across particularly South Eastern but also Belfast Trust. And that's a crucial thing to unlock really this app as an engagement tool to help us interact. We need to find rules and how that can work, and how we can, what responsiveness we can expect.
So for example, I'm a consultant nephrologist. So let's say a transplant patient or one of my dad's patients on the My Care app then sends me a message that traditionally is not the route patients, you know, so is that going to go into a pool and then someone decides that it goes to somebody, or?
Yeah, I think that's necessary, Declan, because I mean, you know, as professionals, as human beings, we need leave and we need time out. We can't be immediately responsive when a message comes in, and there are other people that can deal with those as well. So it's definitely envisaged that there'll be if you like, a reception pool, a bit akin to secretarial services taking phone calls, and then that will be passed forward to us if that's appropriate, or if we're not there or not available to answer that question on someone's care, that will pass through to someone else who can answer on our behalf, or at least we can get back a message. So thanks very much. It's not something that we covered because it's only in pilot at this time, but it's a natural question and a definite ask. Melanie? Melanie, can't hear you just yet. Okay, Melanie, if you don't seem to be muted, so I don't think we're not getting any audio through. If you don't mind, if you want to work on see if you can resolve that, I'll move on to Linus. But if you can't get anything sorted, please put the message into the chat and we'll have a look at that as well. We'll have a quick rundown through it. Linus?
Neil, am I right in saying that it's only secondary care is available at the moment?
Should be, yes.
So there's no social care or community information?
The results from community and social care, if they're requested from those individuals, should be available, yes.
So it's down the secondary care line?
Yeah.
Okay, thank you very much.
Appreciate it. Suhan?
Hi, Neil. Thank you for all that useful information. I suppose, having looked at apps from a different perspective, I'm looking at the accessibility side. I know you've got the disability group, people with disability, to come and support you, but are you looking at people with visual impairments, people with other kinds of disability? How will the app work? Is it able to work, do the screen reading and et cetera, for accessibility access?
I'm not actually sure about screen reading, Suhan. It's an important one, and certainly it's one that I think the patient group's looking at the moment. Jonathan, you just put up your hand. Do you have information about that?
Yeah, I do. The app has been tested with a number of screen readers. I don't have the list of those to hand, but I can try and get them for you. But certainly it has been tested. There are a number of members of that Patient Engagement Council that have kind of various accessibility needs, one of those being visual.
Yep.
So there has been certainly they've been happy with what they've been able to use it using their screen reader, and I know it's been tested with a number. Yeah.
Yeah. And language as well, from a language, is it still going to be English only then for the foreseeable future?
There are a number of languages enabled, Jonathan.
Okay.
I can't remember what the shortlist is, but quite a few.
Okay.
Is that available at current function?
Sorry, Neil, My Care at the minute is English only for now. That's something that we need to circle back on.
Yeah, because of the EDI side of the house as well, as you will be aware. Okay, no, that's great. Thank you. At least we know it's either been considered or has actually been actioned. Thank you.
Thanks, Suhan. Melanie, your hand's still up. I can see your sign showing. Do you want to talk? Okay. There's a few questions in the chat, and I think Graham's been magnificent in answering those now. Anyone that you want to bring out, Graham, that you want us to talk about?
I'm still going through here. There's one from Donna. There is, which I would need further information on. So it's if Epic labels used and GP ready access with one of us, these are still secondary care bloods visible in My Care.
Yeah, I would think actually Donna's right. They different arrangements about this, but really the primary care is acting as a blood taking agent. If the request forms are correct and identified as the secondary care clinician requesting those results, those will route back to the secondary care clinician and therefore be available in My Care, so it shouldn't affect the visibility in My Care. Declan?
Neil, I think you've some of the questions were all around proxy access, which I think you've answered most of those, and then we'll put a link in at the end to the My Care page on the website. The other one just that is jumping out at me is My Care app can be used for consent forms, other forms for patients to complete, and does it then upload into the relevant patient encounter?
Yeah, we're actually looking at the different functions that can be used for that, whether they're pre-clinic questionnaires, post-clinic questionnaires on symptom control, well-being, the different risk scores. There's a huge amount of possibility here, Don, for what we can potentially do. And again, we're engaging with individual services about what they would like done and what we can do for them. I mean, the potential is massive, and that then feeds into a part of the record of, if you like, patient submitted information. It's going to be of huge value to clinicians and to improve patient care.
Melanie has put her question in the chat.
Oh, yes. Oh, good. So Melanie's a health visitor and community based. She's getting queries from parents wishing to have proxy access to information for babies and toddlers, but they've no information. Where do they need to be directed to make the request? What's the process? Can health visitors grant or request proxy access on their behalf? I'm not actually sure about health visitors myself. I know that health and clinical care professionals can. It's something that, but you're talking about a particularly vulnerable group here who are discharged, from hospital, not under care of an obstetrician or necessarily another secondary care clinician. And that's something we'll have to look at. Does anyone on the call know about the role analysis for health visitors?
Neil, just as an overview, that is something that is currently being looked at. So it was originally agreed that it would be band 7 and above, and now it's going to be re-looked at and potentially be role-based. So the trusts are looking at who currently has it and what roles need to have it, and then they're going to come back. We'll review it in the regional group.
Great. This is important. It started as a band or level based access, but it's very clear that it's much more importantly it's determined by role, and that actually could answer the question, Melanie, and something that we'll take forward when we're talking about which people are have the permission to grant My Care access, proxy access. Declan?
Dr. Black, in terms of the public engagement and rollout, whenever NACR came up, every household in Northern Ireland got a letter telling them about NACR and if they consented to the data. Is that going to be the same as how you're going to enrol all the patients? Because South Eastern Trust has been live for a year and they only have 8% of its entire population. I'm just curious how you're going to get more numbers.
Yeah, well, it's happening naturally, Declan, but due to healthcare and social care professionals encouraging people to access the app, and of course then that's in line with the number of people that then are attending episodes, and so that's part of how it's accruing. But there was a public awareness campaign that started in September, I think, shortly before the November go live for the Northern Trust, and a lot of materials were made available and then recirculated out onto Trust websites and other social media outlets. In addition, anyone who had a Northern Ireland Electronic Care Record, that's NICR, patient portal access, were all contacted individually to ask them to move to download MyChart and then enroll for My Care. So we've already moved with those that were already engaged with the NICR portal as well. So that's an ongoing public information campaign, and we're very careful that it wasn't a launch. It was never a launch. It was launched at the time that the South Eastern Trust went live. This is a public awareness campaign, and therefore it's less discreet in the sense it wasn't a single event. It's an ongoing effort. I can't encourage you enough to ask people who attend, you as healthcare professionals or social professionals, to download the app to get their information, and it's up to them how many take it up. There's a question there from just up to the way from Sarah Gurley. Do patients have access to all results immediately, or do we get to see them first and action them? There's a number of different schedules for how that happens, Sarah. Most normal results are displayed immediately. Abnormal results then are given, I think it's a 14-day window before then they are released, but certain results are, and that's to allow us to have time to action them. However, a health or social care professional who receives that result, but within that 2 weeks, can then go ahead and release that result with a comment by direct message as well. That's a one-way message for now. And then action that with whatever actions need to be done, and also issue the formal letter. So it may be incidental findings, or a result in the red which isn't particularly abnormal and is normal for them and stable, and we may feel the need to communicate that at the time. The results that are excluded are the highly sensitive results, for instance, like sexually transmitted infection details initially, but also sensitive cancer-related materials like reports which reported previously on known cancer. It's important that that's dealt with sensitively and individually as opposed to shared blindly. From Bernadette Marshall's mentioned work with carers of adults with learning disability, and now their views being represented in Patient Client Council regarding the My Care app. Jonathan, can you tell us, with learning, I would presume that is the case?
Yeah, we do have a fairly wide representation on that group, but comment as well there, we are currently kind of actively recruiting and accepting interest from new parties. We're going through a process of that at the minute, so if anybody does know anybody that falls within that category or wants to be considered for joining either the main Patient Engagement Council or the disability subgroup that we're in the throes of setting up at the minute, please do let me know. I put my email address into the chat there, so feel free to use that as a first point of contact, and then we can take it from there.
Great, Jonathan. That's very helpful. I can presume, but actually knowing what happens is important. Just moving down, Adrian Krabs asked about proxy access. Can users provide proxy access to their My Care? Yes, absolutely. A competent adult. I mean, if you go now and download My Care or My Chart and enroll for My Care, you will be able to find a sharing centre where you can share access to your full record or a limited view of your record to anyone that you choose, whether they're your children or your spouse or a significant other. And you can actually provide access to as many people as you really want. You can also view then later on who has access, and if you change your mind, then you can revoke that yourself. You have control over the flow of your own information as a competent adult. Maybe you answered the next one or two. Yeah, Paul Cadell said not seeing healthcare professionals on the ground pushing sign up just yet. I think that's fair enough. It's perhaps a lack of availability on healthcare professionals, and hence a session like this to help healthcare professionals, health and social care professionals, become more comfortable with it, about information that actually ultimately people have a right to their own information by subject access request under the law, and they can get all their healthcare information ultimately through that process. This is an agreed way to share that information in a more fluid and live way rather than by subject access request. I mean, this can fly in the face of a number of different principles that health and social care professionals can have, and about how much we value protection of that information for people, and how, you know, there's always the question of, oh, it'll cause more questions. Maybe it's better that people understand what's going on, and maybe a primary role as health and social care professionals after looking after people is to communicate that to them so they can engage with their care and become partners in their care, as opposed to us telling them what to do. So I can see some healthcare professionals feeling less comfortable and less willing to encourage people forward, but those people can go back home and in the car park, even before they've left the hospital, download the app anyway, irrespective of whether it's been promoted or not. Let's see. Okay. I think, Graham, you've dealt with the other questions. And have we any other hands up? Or anyone want to raise anything or ask a question to clarify before we close up? Julie?
Hello, Neil. I just wanted to ask about appointments. Apologies, I had to take a call there, so you may have covered this in your, I'll watch it back. But I suppose it's this issue about people being able to schedule appointments.
Yes, that's not currently enabled at the moment, Julie, but we're looking at that choose and book type approach for I think particular types of HP groups in the Southeastern Trust at the moment, and looking at how that would work. And they're very keen actually to get that enabled for them. And then we'll be looking at how that can also be done. We are looking at enabling right now a check-in facility where people can show that they've come for their appointment.
Yeah.
Thanks, Julie. And we have another Julie.
Can you open an account for a child?
Yeah, the child on their own credentials.
Like under 16, like so.
Yeah, that would, I think that would need a health or social care professional. Now, if you want to open them, and it's because there's information.
You don't have to then, really. You don't need to.
Yeah, it is whether that individual would be competent to consent to using that information, because if you open an account in their name, they'd have to be competent to share that information as well. So if for a particular young person who's mature, yeah, possibly, but that would, under the age of 16, that would have to be agreed by a health and social care professional.
It's not really for children under 16 then, this app, no?
Well, it's certainly, I mean, it's potentially, a younger person that's particularly competent, a health and social care professional could give them access. But once they're over 16, that's a matter for themselves. The younger kids, but parents can and carers or guardians with legitimate interest to look after their healthcare affairs can be granted proxy access by a health and social care professional to help with the delivery of their care and understand what's happening with their child, Julie.
All right, so we'll just not open one, we'll just
yeah,
until they're older.
Yeah,
Okay,
it's
thank you.
protected. Interestingly, at the age of legal majority, all that proxy access from parents ends, and then it becomes the child's responsibility, well, the legal adult's responsibility to then choose to grant that back to their parents, and that's a protection step that's fairly well ingrained in all EPIC implementations. That if proxy access exists at the 16th birthday, then that expires, and the young adult has to choose to do it, and that's within the sensitivities of the family. And it's not for the system to administrate, other than to say that they now have responsibility. So it's an important recognition of their autonomy.
Thank you. Thank you.
Eilish?
Yeah, no, I just want to ask something simple. Just where do we go to get all of the posters with QR codes and stuff? Because I mean, if they should be up in all clinical rooms and everything, I'm not seeing very many just at the moment. So where do we get them? Just as
Go to your Encompass program team, and they have a communication manager, Eilish, and they should be able to get you everything that you need. That's where we got our fancy backgrounds for the for the meeting. So
Okay.
if you haven't got any, and it's quite likely it's easy, particularly smaller community facilities, it's quite easy to miss those and
Yeah.
go for the big hit acute areas. So please do, if you know areas, and ask them and disseminate them out.
Yeah, no, that was one of my questions just on the chat as well. It was just about the advertising. I still feel that a lot of patients don't know about it, and obviously you're able to easily share the link, but patients still don't know. So I think, yeah, as much advertising as possible.
Yeah, really, and the more people come to something like this, really edifying to see the number of people that are interested in this. The more of our service users and our patients are going to know about it, for actions that you're doing. Julie? Oh, you're still muted.
Apologies. No, I was just going to say that I'm delighted to see the My Care Helpdesk and the contact telephone number, because I suppose I know a lot of older people in my family that would be interested on the My Care app, but are having difficulties actually getting it. So, so I just think there should be help for people that maybe are not as able to download apps and sort that out.
Yeah, and that's one of the reasons that exists. And a good chunk of the other third of calls, Julie, are about actually getting access. And the My Care Helpdesk, then when it's specifically an identity verification thing and needs NI Direct, there's an NI Direct helpdesk that we can pass people forward for those specific needs. I'll just paste the inquiries thing again into the chat, so you can take that and share it with your relatives, and hopefully they can get the help they need.
Brilliant. Thank you.
Pleasure. Okay, Dawn.
I think that's been it. Yes, it's been very informative, Neil. It's been great. So yes, thank you very much, and thank you to everyone for your questions. I suppose just from a digital dispatches point of view, given that there are so many questions, it would be good if anyone that has joined today can let any of their colleagues know this digital dispatches will be subtitled and then uploaded onto our DHCNI TV on YouTube, hopefully by the end of next week or early the following week. Also, there is a whole My Care page on the DHCNI website, and I think Chloe put a couple of different links in the chat there. So there's frequently asked questions. There gets into some details on proxy access and how that's granted, and all of that. So there's and the emergency telephone numbers and everything are all covered there as well. So you can even direct colleagues there if they're asking you questions that weren't answered today or you don't know the answer. So thank you very much, everyone. Yes, and there isn't a digital dispatches in January, but then the next one in February again is at 1 o'clock on the first Friday in February, and it's on the HSC Apps Library. This one, it's trying to promote prevention and self-care and people taking an interest in control of some of their own ailments or conditions by downloading apps that can help them. Thanks very much, everyone, and enjoy the rest of your Friday. Thank you.
All the
Thank
best.
you.
Thank you.
Bye.
Thanks.
Cheers.